السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم، الحمد لله والصلاة والسلام على رسول الله الأمين. مرحب بكم مجددا. نشكركم ونشكر الدكتورة عاطفة والأستاذ خالد وكل الناس الشغالين زي ما يقولوا من على البعد لهذه الدورة التدريبية. سعيد جدا أكون معاكم يعني اليوم عشان ان شاء الله يعني كلنا نتعلم من بعض في التريننج اوف ذا ترينر كورس. وخلينا كده نتعرف عليكم لو امكن في بدايه الدوره التدريبيه، ويعني ما شاء الله العدد بخلينا نخلي الموضوع مور انتراكتيف وناخذ فيه ورك شوب وناخذ فيه ديسكشن بصوره او اخرى. نبدا ب دكتوره هنيده. تفضلي دكتور هنيدة، لو تعرفي نفسك وشغالة وين. يس. خالد أحمد. شريف حسن.
Yes.
Yes, Sharif, can you introduce yourself, please? Mr. Khalid or Dr. Atfa, if the participant has the access to mic, please. Yes. Sharif. Khalid Ahmed, I need your feedback, please.
السلام عليكم دكتور.
عليكم السلام، مرحبا بك.
أسعد الله مساكم بكل خير.
Can you introduce yourself, please?
خالد عيسى محمد من المركز الأمريكي العالمي للطب والموارد البشرية. مرحبا بك إن شاء الله في المحاضرة.
مرحبا خالد، هل الناس عندهم اكسس للمايك يقدروا يتكلموا؟
أي نعم، بيقدروا يتكلموا، لكن يبدو أنه بس ما منتبهين للمسألة بتاعت الزمن. شايف في اثنين عندهم أول كلهم عندهم أكسس للمايك. ممكن تاني نحاوله من المرة الثانية.
طيب يا شباب، في واحد مسجل بجالكسي. Can you just introduce yourself? Or maybe مودة محمد ياسين. We are talking about training, and one of the key elements of the training is to use the interactive approach with the participant. So I need your feedback to make sure you are with us.
السلام عليكم.
Yes, عليكم السلام. هنيدة، دكتور هنيدة. Yes.
Yes, I'm Dr. Hunaida, general practitioner and CBHQ certified for healthcare quality and also internal auditor. I'm currently working as a quality assurance officer in insurance company, and also I'm a trainer for the new joiner, and I'm doing the guidelines, the medical guidelines, and at the same time I give a training whatever we design for a guidelines or a new project. So that's why I'm joining this course. Hopefully we'll get more knowledge and will be more professional in this way.
Excellent.
And welcome to all the...
In Sudan or where?
I'm living in Qatar. I'm working in one of the biggest company, Qatar Insurance Company, the medical department in that company in Doha.
Okay, welcome, Dr. Hunaida, welcome.
Thank you so much.
Yeah, other participant, please. Anyone can introduce himself or herself? Okay, no problem. Just we will start just to gain time. So this is just a starter for the presentation, and I feel it is very important whenever you would like to go for learning, keeping up to date, keeping abreast with the current evidence, current guideline, you need to learn. But the best approach for learning, as we will see from the different research in the training program, is teach to learn. And therefore, Sharif, can you unmute your, yes. So teach to learn, and whenever you would like to learn something, you have to teach others. And for example, although I delivered this training before, but now we need to update the material. And of course, after these 5 days, I will learn something. I will learn from your experience. I will learn from your knowledge. And this is actually what we need when we think about training others. And I always started by this learning pyramid, and it is very clear. If you can see it, it reflects the way we deliver the information to the participant. And therefore, when we use like passive approach, like just didactic lecture, the retention rate will be maybe 5% or even low. And this is when we talk about the interactive lecture or interactive session. However, using multi-methodological approach for the training, this is definitely will increase the retention rate among the trainee. And therefore, as standard guidelines here, for example, in the training program, for any training program, the percentage of workshop should represent 60 or 70% of the training program, and the theoretical background will represent at least maybe 30 or even less. Because nowadays, with this epidemic of informations and every day, and you can access the information is just the tip of your finger, the information is there already. But the challenge, how you train people this information and to make sure the information that match their need, and trying to match this information with the outcome, whether at institutional level or even at departmental or individual level. Therefore, like Dr. Hunaida, for example, one thing that she can make to increase the training capabilities of the staff, or especially the new staff, is try to assign trainers in the department, and she only governs the training program, and the trainer can do the work, and just she should ensure that the training is aligned with the organizational vision and objective, and we will see this later. Therefore, from this slide, the lesson learned, we need to make things interactive. And I'm very glad to see the number of this training is 8 or 10, and this is excellent for me, because we can allow the participant, for example, tomorrow or maybe the last day, to deliver some presentation or to deliver some training session, and we will try to give him or her feedback about the material and about the way of the training others. And therefore, this training program, we will see the course map in the next 5 days. We will try to equip ourselves with the knowledge and skills that need for the training. And when we say training, I'm sure when we talk about the expectation, we are coming from different background. So even in healthcare, whether we are talking about training in insurance company or a private hospital or even general hospital or semi-governmental hospital. And even that within the hospital, are we targeting those who are working in the ward or in the emergency or in the home care or even in the ambulatory care? Because each setting has its unique area for the training program. And therefore, I request from you all, based on this slide, please stop me at any time to ask question and stop me at any time to add any information. So we are here not to train others, we are here just to agree upon approach for learning, and definitely we learn from each other. And therefore, I would like from you, if even you can write in the chat, what is your expectation of this program? And I will request Dr. Atifa or even Dr. Khalid, if possible, or even me, let us to write down the expectation of the participant, and we will try to monitor whether we achieve this expectation or not. So if possible, I need your expectation, please. Yes, please. Start with you, Khalid Ahmed. What is your expectation? Yes, why you are here? I know you are maybe coordinating, but also what is your expectation of these 5 days? Dr. Khalid, we are waiting for you. Yes? Dr. Sarah, please. Sarah? Introduce
Hello.
yourself. Yes, yes.
Assalamu alaikum.
Alaikum salam.
Okay.
Can you introduce yourself?
I just joined the meeting.
Welcome.
Okay, thank you. What's the questions?
Yes, I'm asking you, what is your expectation of this program? ما هي توقعاتك للبرنامج ده؟ يعني ايش تبين منه زي ما بقولوا هنا مثلا؟
Yeah. I understand you.
Can you introduce yourself, please?
I want to be, coordinator, and I want to be, kind of team leader. In my career, and I love to be, like coordinator. Yeah, that's
Excellent, excellent. Can you introduce yourself? What is your background and where are you working now? دكتورة سارة؟
hello.
يس انا سالتك يعني انت الباك جراوند تبعك شنو، شغاله وين؟
انا طبيبه.
طيب.
اشتغلت يعني like 4 years in hospital, different hospitals, and I went to USA last 6 years, and I worked like a teacher in some school. but not in my, my career like a doctor. I was a teacher, but I love to be teaching in my, uh, background job. Like I want to teach the medical studies and something like that.
Excellent. Thank you so much. So I just wrote down your expectation
Thank you so much.
to be a teacher, or we can say
Hello,
facilitator,
Doctor.
instructor in the healthcare.
Hello.
Yes, Sharif. Sharif, please. Sharif.
Expectation and everyone that through time when they feel the expectation or pressure to achieve certain things and behave in a particular way or even to look at certain way.
Sharif, where are you working, please? And what is your background?
My background is in Somali.
No, I mean the professional background.
I'm a student. I'm a student. I'm a student in medical lecture at Salam University in Mogadishu.
Okay, welcome, welcome, Sharif.
And I study Faculty of Medicine and Surgery in Salama University in Mogadishu.
Excellent, excellent. So, what do you would like to have after these 5 days? What is your expectation?
What is our expectation? Expectation is everyone and goes through time when they feel the expectation or pressure to achieve certain things, behave in a particular way, or even to look certain way.
Okay, okay. So I just guess what you are saying. You would like, in terms of the training, and because this program is about training of the trainers. Did you train? Did you have any experience in training before? Sharif.
No, and I have not experienced and because I am in semester 2 in a medical lecture in Salama University. Still
Excellent,
we have
excellent.
and
Excellent. Thank you so much. And also would like to thank you because you are in early
thank you.
medical school and you would like also your vision to be trainer. And even we will talk later, the training doesn't necessarily to be when you are in healthcare professional, but even within the medical student, for example, you can develop training as this is a part of peer education. Huwaida, back to you. Huwaida Saleh.
Thank you.
Thank you, thank you.
Thank you,
Yes.
sir. Thank you.
Yes, what is our
Yes.
expectation?
Okay. See, from actually, although I have the background and I already, on this, I'm give a training. I'm training actually, but my expectation that I will be more professional in training, and I will give them. I mean, whatever the message that I will give to my trainees, it will be very easy. And instead of took like 1 hour, my expectation of this, after this, session or course, whatever I need instead of 1 hour, I can give in half an hour. That means the easy way, the most professional way, and based on the scientific way. I know if every whatever now we have like even training, and even now any part of our life today, there is a study on that one, and there is some people they go beyond that. They have a doctor, even doctoration in that their own professional. So definitely, what we're doing now, maybe it's not the proper way. Even if we think that we are right, if we get a training from a professional people like you, doctor, then definitely it will be more helpful for us. We'll give the message in easy way, and even our trainees, they will they will have the very clear message, and they will get the material and the subject that we will give. The message, it will be very clear and in short time, and definitely it will be positive feedback. And then we will push, whatever we need. It will be in good way that you will give the information, because sometimes you don't go beyond the people in front of you. You will just give your subject and then you will left. But actually, so many things behind that, how you will give the message, and when you will select the time to give your message, and how you will go to get the feedback that people they have already received, what exactly the purpose of your training. So this is my expectation, actually, to be more professional, to give the training in a professional way, and to make the time less. Instead of session or seminar or whatever for 2 hours, I can give it in 1 hour only. And even the material that I will use.
Thank you so much, Dr. Huwaida Saleh, and this is definitely a clear expectation, and we will try to cover it, how you make your training is an efficient training program. And also we will see in the content, we are talking about, for example, bedside teaching when we talk about hospital. But when we talk about, for example, the organization, we'll talk about what's called on-the-job training. So this is also, it can take maybe shorter time, or even the session which you deliver to a large participant, how you make it, for example, a lean session, how you make it more effective, how you make it more efficient, how you, for example, you design a curricula that can match the needs of your participants. Thank you so much. And also we will talk maybe at the end of this week, we will talk about the characteristic of the professional trainer. And you talk about, for example, to be a professional training. So what is the attributes of a professional training? What is the characteristic of a professional training? And how can say this training is a professional? And definitely there is certain attribute need to be acquired explicitly to be a trainer. Okay. Anyone, please? Yeah, anyone would like, because I didn't see name. I see Galaxy J4, Galaxy 7J. Yes, anyone would like to add her expectation or his expectation, please? Yes? You can write even in the chat if you don't would like يعني, to speak in mic. Yes, please. Okay. So if somebody of you would like to add something, just stop me. But generally, we will continue. Yes, would like to say something? Yes. Would like to say something? Galaxy 7J Pro. Yes, let us move, and if you have anything, maybe we can discuss it also. So this is just our learning outcomes of these 5 days. What we would like to achieve together? First of all, when we say, for example, training need assessment, what exactly this means? And how we can conduct practically a TNA in our organization as an important. Yes, مودة. مودة السلام عليكم. يا مودة
بس مستني انت هتكون شغال امتحانات.
مودة can you unmute your mic please? Yeah, so first of all, we'd like to understand the context of a training need assessment and why would like to deliver training. Then we are all in our institution, we train adult. So how does adult learn? So there is certain theoretical background that we need to understand it in order to develop our curriculum. And also how we can facilitate adult learning. And also like when we say facilitation, so what is the different technique of facilitation? And why we do facilitation in the training? And what does this word exactly mean? And again, when we deliver any training, like this training, the expectation is different. The learning style is different. There is some expectation in the knowledge, attitude, and skills. So how we can tailor our program to the different learning style of the participant to ensure equity in the training program, and also to ensure every participant in the training program have an equal opportunity to be trained. And again, do I need to develop a module? And what is the structure of the module? When we are in health professional education, like Sharif, for example, in the Faculty of Medicine, what is the characteristic of the module there? But even in the healthcare arena, and where there is a complexity in healthcare, what is the structure of module for the delivering the training program? And what is the effective teaching skills? And last but not least, how we can evaluate our training program. So our contents are, this is the course map. So we'll have introduction, just cognitive information about the training, teaching, concept of the training, why training now is important. And also we will talk, this is the different, we'll talk about training need assessment here. You can see we'll start with introduction, training need assessment. So assessing the need of your employee. We'll talk about adult learning theory and different theories talking about how you're teaching adult, and maybe we can talk about some theories like Bloom's or Miller pyramid in teaching and learning, especially in clinical setting, learning style. How can I assess my participant learning style? How I plan for training session, and also how I give the feedback, constructive feedback to the trainee. And now we are in the COVID pandemic. There is an increasing demand now of the virtual training. So the virtual training, like just our training now, with some complexity related to the technologies, diversity, the remote people, how can I deliver an effective virtual training? And last but not least, how we can evaluate the training. And therefore, our approach for this training, we will try to make it interactive with questions, with answers, with the group work, in order to digest the knowledge from the training program. I need from, for example, where is Dua? Dua, please, can you read this statement, please, Dua? دعاء أو مودة تفضل يا مودة. سامعني يا مودة؟ I need your feedback. Therefore, feedback is very important. Just to make sure the student is with you. مودة؟ تسمعينا يا مودة؟ طيب جالكسي اللي مسجل جالكسي ده. السلام عليكم.
السلام ورحمة الله وبركاته. دكتور حاتم.
مرحبا بك، ممكن تعرف نفسك لو سمحت؟
ده معك هاشم يا دكتور حاتم، مكة المكرمة.
مرحبا بك هاشم، مرحبا بك. وانت شغال في شنو يا هاشم؟
أنا ميديكال لاب ساينتست يا دكتور.
مرحبا هاشم، مرحبا بك. هاشم ممكن تقرا لنا بس السلايد دي، جس قرايه كده ممكن؟
Yeah, remember training is not what ultimately important. Performance is.
يعني شنو؟ تقدر تشرحها لنا؟ ايش اللي فهمته منها؟ اقراها مره ومرتين. Yes. Remember training is not what is
it meaning هي الكونكلوشن بتاعها يا دكتور الإنجاز، يعني البرفورمانس هو الإنجاز يعني.
يا سلام
يعني.
عليك. يا سلام عليك. يا سلام عليك. طيب في واحد عنده إضافة من الشباب الباقيين البارتيسيبنت، في واحد عنده إضافة؟ في واحد. طيب جالكسي الثاني، عندنا جالكسي ثاني برضه، واحد داخل من جالكسي. يس يا شباب عشان الزمن بس محتاجين الدسكشن. طيب why I start with this quotation? Because it is not only the training. No. Always begin with end in mind. What is the objective of the training? What is the ultimate goal of the training? Definitely performance. And therefore, when you focus on the performance of the employee, this is the drive of teaching, this is the drive of assessment, and this is a drive of performance appraisal. And therefore, now most of the government institutions started to implement what is called appraisal performance form. And when you look to this appraisal performance form, you will see some competencies and some objectives that designed by the employee to be achieved at the end of the year, and therefore the training should be one of the cornerstone or even the backbone of the performance. Yeah, no problem, no problem. So let us start with the training need assessment. And before we start with the training need assessment, يعني no organization, I can say it, even in everywhere, where a training is not a part of its strategic and operational plan. And therefore, training is a necessity. And many organizations invest million of dollars, whatever it is, on the training. Why? Because now, even we are in the 21st century, the knowledge is the power. And the talented people definitely is also power. And how you encourage people to be talented or to be innovative or to be proactive, this is definitely need training capabilities. And not only that, if you need the productivity, you need training. If you need the patient satisfaction, you need the training. If you would like, I know some of you, for example, have CBHQ, for example, or even CBBS or CIC, all this professional certification, training and education is the core competencies of all these professional certification. And even in the quality, you would like to train people about the quality concepts, whether the background information of the training or even the tools of the quality concept when you are talking about BDCA, Lean Six Sigma, and whatever tools. This is definitely need knowledge and skills. And therefore, in order to transfer the knowledge to the employee, first of all, we would like first to appreciate the importance of the training as capability building for the employee. Because some of the organization, they think that training will consume the budget, and training is a waste of resources. And therefore, they will lose definitely, because the skills of the employee, if not updated, if not upgraded, the employee will be work as usual. And now we have smartphone. And if you ask yourself how this smartphone came to the reality, it definitely people recruited talented people, an agile environment, software developer, and they think they have a critical thinking, system dynamic, whatever of the thinking, they are innovative, and this created those smartphones. And even in the hospital, if you would like the healthcare provider to provide an evidence-based approach for patients, they need training on evidence-based medicine. If we would like the nurses to implement the infection control measures, definitely you need training for infection control. Even the manager, even the cleaner, if you would like the cleaner to clean based on standard and guidelines, you have to train him or her. And I will give some story, maybe few years back. I was in a training course in Nairobi. And by the way, there is an institution called AMRIF. It is called African Medical Research Foundation in Nairobi. And I spent there 1 month in a T.O.T course. So it was a 1 month full program from 8 to 5 o'clock. But what I would like to mention here, not only is this the institution, I remember in the cafeteria and in the restaurant, when I start to eat something that I did not like, so I changed my face. And the one who worked in the kitchen, she came to me and asked, what has happened? And I said, no, it is okay. No. She said, no, what has happened? Did you like it? So I asked what type of food is this and this, and then she know my culture, and she cooked another food again and brought it to me. And after 5 minutes, she came and smiled and said, how do you like it? Did you like it? How about it? And she started asking question to achieve my satisfaction. And then I said to her, thank you so much. But why you are doing this? She said, I receive training every year, at least 3 or 4 courses of training in how to achieve the customer satisfaction. So what I'm doing now, I'm doing because every year I updated my knowledge about the customer behavior and how this training matter. And therefore, even you can train even the cleaner. Even the cleaner need training to clean well, because he or she, he will be also a part of, for example, a part of organization. And not only that, let me share with you another experience back years in Wad Madani, at that time as the Minister of Health. So we realized that during the environmental supervision and food hygiene supervision as a public health professional at that time, we noticed that some of the employees in the restaurant, they don't understand the health card. And they think that health card is just a budget given to the locality, but they don't understand that health card, it means that you are fit to deliver food. And we conduct a training need analysis, although it is not, we'll talk now, it's just we observe. When we are visit some restaurant, we found people have long nails, the hygiene is low. I personally asked some of the employee, why you use health card? He said, no, health card, this is يعني قروش تدفع للمحلية. And I asked also, يعني, do you know the typhoid fever, how it can be transmitted, hepatitis? They don't have idea about that. And what we did actually, we delivered a training program. And those of you who know Madani and Suga Shabi, we deliver the training is just under a tree in a Suga Shabi, and we train 30 participants from those restaurants. And the training curriculum with simple language about the importance of health card, about the importance of cleaning, about the importance of hygiene. And I remember at that time, the program has been يعني التخريج كان بواسطة Minister of Health. And after the training, when we came to follow our training, we observed that if you would like to come to any of them, it is clean, people wearing a uniform, and even if you would like to eat something, they asked, they said to some of the customer, please go and wash your hand. Wash your hand before eating. And you see this sort of behavior cannot be implemented unless people changing the behavior, unless people train people. So training everywhere. So if you would like to improve the performance of any employee, let us start with the training. And therefore, the first step, what is the training need assessment? What, why, and how? And I think this is a good framework when we talk about TNA. What is the training need assessment? And why we do training need assessment? And if we understood now what is training need assessment and why we do it, so we would like to implement it in the reality. So how? Let us do it together. First of all, what is the training need assessment? Any background? Any idea, please, from the participant, just to make it interactive? أنا ما أبي الناس تنام، أرى عيونا قد أينعت. Yes.
Yes, hello.
Yes, hello. Yeah, what is TNA, training need assessment?
DNA training assessment.
Yes, what exactly when we say TNA?
DNA.
Yes, what is that?
DNA, these are special enzymes that's found in the human blood.
No, sorry. I'm not talking. I'm not talking about DNA. I'm talking about.
Okay.
Let me just show you here. I'm talking about training needs. Training needs. What is the training needs?
Training. Okay,
Yeah.
right. I get you right now correctly.
Yeah, what does the training need?
Before I thought that you asking me what about DNA.
No,
Yeah,
yeah.
training is a very important session.
Yes, excellent. And this is one of the يعني
Hello.
yes, I'm hearing you. Carry on. Yes,
Hello.
what is the training need, Sharif? What is the training need?
Yeah, I did.
Yeah.
Now you hear me?
Yes, I'm hearing you. Carry on.
Okay, training is a very important session. It helps the person to become well qualified and
Excellent.
expert, and someone who has a qualification for the field now that is studying when he get a training.
Excellent. Excellent. Thank you so much. Thank you so much. And one lesson learned here in the training between me and Sharif, you have to be very
Yeah,
focused when you are talking about things. I'm saying DNA, and because it is a distant, he interpreted it as DNA. So I would like to make sure he understood the right way. Thank you so much. Any other suggestion from the participant, please?
thank you so much.
Thank you, thank you. Yes,
Yes, hello.
يلا تفضلي.
Yes, DNA, I think that is to assess the current knowledge for your trainees, actually, and just to assess the current existing knowledge, and you will make the gap between the subject that you will give. So at least you will know how you can focus on your training material, I mean, subject mainly.
Thank you. But are we assessing only knowledge?
Not only, but I just give an example for the one of the assessment, I mean, tools to start by the knowledge. I mean, and even sometimes you will know it's important to know how they will receive your or the trainees, how they prefer to receive in their native language and in other foreign language. This is very important because, for example, if you have a trainees, most of them, for example, Arabic speaker, and you want to give, mainly you want to give some scientific knowledge. It's not about the language per se. So if we can make, like, a very short survey or whatever questionnaire that is not survey, actually questionnaire, that how you would like to receive this training. For example, if they all of them they said Arabic, so if you give this training in English, definitely that mean maybe majority of them they cannot understand you. So this is one of the assessment that I'm talking about. Maybe I'm not sure about the whole other. It will be like, the asset itself, how you can give the material that you will use, I mean the media that you will use. All this is kind of assessment which it will be acceptable for them. Some people they need to see, I mean, the trainer face to face. Some of them they can accept, yes, the comfortable way that like what we're doing now, virtual training. So this is one of the assessment. But for myself, I feel that is to assess the gap between the training target and the knowledge, the current knowledge for the trainee is very important. At least, instead of starting from step A, you can go directly to step B. Or sometimes you need to go below this level A, for example, the first level, because maybe they cannot understand even the terminologies, for example, as per the training subject.
Thank you, Huwaida. يعني Huwaida definitely talk about the concept, what about the gap between the current knowledge and the desired knowledge, if you can say it. And also she talk about after your TNA has been conducted, you have to tailor the content of the training to match the culture of the participant, to match the language of the participant, and even you can evaluate that. Thank you so much, Dr. Huwaida. Any other comments from the participant, please? Any other comments? Yes. So the training need assessment, what exactly is this? First of all, the key words is systematic. It is a systematic. It is not something عشوائية. It is not something haphazard. It is something systematic approach, systematic methodology that aim at using various tools and techniques that aim at assessing the current competencies, current knowledge, current skills, current attitude of the employee relatively or with relevance to the desired performance. So this is the keywords here. It measures the gap between the current knowledge, current competency, current behavior of the employee, and this gap is called training need assessment. Again, why we do training need assessment? Yes, we do training need assessment to make sure that the training we deliver match, as mentioned by Dr. Huwaida, match the need of the employee. Also, if we don't do a proper training need analysis, we can conduct several of training, and this will be waste of resources. And we know nowadays, most of the company face or hospital face critical shortage in the training budget. So therefore, we would like to allocate and prioritize the training to fit the need. And you remember in the starter, we will do training, and why we will do training need assessment? Because we would like to improve the performance. So I cannot improve the performance of the employee, I cannot improve the performance of healthcare provider unless I know the needs of the training. And therefore, this is why we conduct training. But how we conduct training? First of all, if, for example, I have been recruited with Dr. Huwaida to develop a training need assessment for the health insurance company. From where I will start it? From where? Any idea? Any idea, for example, the CEO for this insurance company requested you, Dr. Sarah, for example, Sarah, she requested you, hey Sarah, now you understand the TNA, and you convince the CEO of the organization that TNA is very important, and it can also, he can invest on the training because training will increase the productivity. And then he said to you, Sarah, please, can you, yeah, can you show me, or can you just not show me, can you explain how you are going to satisfy the CEO request to develop the training need? Yes, Sarah.
You can repeat the question, please.
يعني السؤال خليني برضه اقوله بالعربي عشان يوضح. هو إذا شغاله في انشورنس كمباني وقام انت بعد ما انتهت الدوره التدريبيه دي رسلوا لك فيزا، قال لك تعالي زوري الشركه، والمدير طالب منك تعملي له تريننج نيد اسسمنت. سالك السؤال الاول، قال لك شنو يعني التريننج اسسمنت؟ شرحت له، قلت له والله هو سيستماتيك وجاب واناليسيز. قال لي طيب ليش نعمله؟ واي؟ تكلمت عن الريسورسز والبرفورمانس والكابابيلتيز والبروفيت. قال لي خلاص من بكره اعملي لنا تي ان اي للاورجنايزيشن اللي فيها 500 موظف شغالين في الانشورنس. من وين تبدي؟ From where you start.
From where?
اي كلام. Anything you can say it is okay. Just don't worry.
اوكي، اول حاجه هشوف النولج بتاعت اللي هم ال 500 ديل، ما حقدر طبعا اعمل لهم assessment all of them in one time او one day. فالزول بياخد يعني زي ما بيقولوا بشكل عام يقدر يعني يعمل تصور او يعمل assessment للنولج بتاعتهم او طريقه الشغل بتاعتهم او كده. عندنا تاني والله صراحه.
ممتاز. طيب انا حتخلوني اديكم بريك زي 10 minutes بين المحاضره دي والمحاضره الثانيه، لانه حنخلص ان شاء الله على 10. في البريك ال10 دقائق عايزكم كل واحد يشتغل، يعني ان صح التعبير ورك شوب مع نفسه كده، يقول لي how he can conduct a training need analysis. So now حناخد ورك شوب. before الورك شوب في اي سؤال؟ before البريك ده اي سؤال؟ يلا يا شباب الان حناخد بريك الساعه 9 الا 5 هنا، ان شاء الله حنجي 9 و5 10 minutes. اوكي يلا see you later. موجودين يا شباب معانا؟ الموجود يكتب واحد بس في الشات. Yes. Okay, we will give you 5 minutes, no problem. Sharif requests 5 minutes, so we will give 5 minutes, no problem. We are starting now, so we will have maybe half an hour because there will be another lecture. So please, how you conduct the training need assessment, from where you start? Yes. Yes, please. Huwaida, this is your organization.
Yes.
So from where you start if you'd like to conduct training need assessment?
Okay. So basically, I will just check for the current performance that the employee they have.
How?
I will just, I can conduct a meeting with their team leader, for example, to ask what exactly the defect, what is the area that you would like, what is the defect exactly? And I will look for the, also their records for the performance in general.
Yes.
And what exactly the standard for the company. If this the achievement for the staff, what exactly basically the benchmark for the company itself.
Excellent.
From that, I can start just to analyze exactly what is the need, what the area, is it knowledge wise or something technology needs, or based on that, I will also I can interview some of the staff.
Excellent.
If you have, as you said, 500 employees so I will make just interview for a few of them just to get the feedback. From these interviews, I can have an idea of exactly what is the need. Is it training or any other, difficulties there more than the knowledge? So if it is sure that 100% from this interview, from the staff and from their team leader and from their performance and from the standard that required by the company, then if it's concluded all that is knowledge gap, then I will go ahead and conduct the training based on that.
Excellent. 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 Thank you so much, Dr. Huwaida. Thank you so much. Anyone would like to add to already Dr. Huwaida mentioned? Then I will recap it to mention how I conduct the training need assessment in the organization. Anyone يا شباب؟ Excellent. So you remember we identified or we defined to the CEO the training need assessment. But when the question say how, it means that what are the tools and technique that you are using in order to determine the need of the training or the training need of the organization. So first of all, you have to submit a plan for the CEO about how you are going to conduct this interview as mentioned. Because you cannot go and directly you make interview. And what I would like from Dr. Huwaida mentioned that, first of all, she look what is the organization wants, what is the standard, what is the performance. And before that, I will ask the CEO, please give me your strategic plan. Why? Because in the strategy, I will look for the vision of the organization, the mission, the values, and the key objectives for the organization. And from that, because I expect that every employee should work hard to achieve the goals, the business goals of the organization. So the first step, I will start with the business organizational plan. Not only that, I can review the lesson learned from the previous performance report. And I will try to look at it and I try to analyze how the performance appraisal is conducted and what's the area that need performance. Not only that, I will do also a desk review to review the different achievement of the different department. What is their achievement? And also, I will go to the occupational health department to see is there any error, any report about the incidents, any report about the mistake, any report about the misconduct, any report about misbehavior. So this is very important for me. When I look, for example, and there is a report which increased the absenteeism of the employee increased last year by 20%. So this is an area of a training needs. How? When I look to the absenteeism and high number of absenteeism of the employee, as mentioned by the quality professional, I need to do what is called a root cause analysis to see why the employee are absent from the work. Is there any problem with the dissatisfaction? Is there any problem with the motivation? Is there any problem with the skills? So I need to dig down in the roots and to see whether this can affect the performance or not. And after I did or I do a desk review, I came back to the CEO and say, hey, you see, this is the profile of your organization. This is the area at organizational level need to be improved. We would like to work hard because our financial report mentions that our productivity is reduced. We would like to achieve the target because our monitoring and evaluation plan mentions that we are lagging behind. And after that, you say to the CEO, look, this is the current situation of the organization as a whole. Let me do looking for the best practices of others to see what they are doing in other insurance programs in the TNA and what are their problems they face so I can meet this with your problem. hey CEO, please let me to do what is called benchmarking to see the best practices locally, regionally, or even globally. And the CEO smile on you and say, good, well done. So please come to me after 2 days because I would like to approve the training plan for this year. And you drink a cup of coffee with him and you return back after 2 days with some of the information of the sister organization in terms of their current performance. And you will realize that there is high competitive matter in the market. And this is also can add to you to the training needs. So the worker should understand that if they don't work very hard, the survival or the life survival of the organization will be very short because there are many competitors in the ground. So we would like to change our way of thinking and also would like to change our way of performance. And this is again one parameter of the TMA. The CEO say to you, thank you so much. Yes, because when I look to the dashboard, our investment and financing going down, we'd like to do something to increase the investment. You say to him, okay, now the picture is clear for me at organizational level. I would like to do at departmental level and also about individual level. And the CEO said to you, okay, go and do it. You have 1 week to do that. So the next week, you conduct a brainstorming session with the leader, the head of the department. It is 4-hour training or 4-hour brainstorming session just to generate idea about the areas which need training in their respective department. And after that, you conduct an in-depth interview to have more focused approach related to the problem, and you select some of the key influential departments based on the desk review you conducted before to see what area needs training. And also, as mentioned correctly by Huwaida, Dr. Huwaida, I have 500 employees. So impossible to conduct an interview with all of them. So I need to use my research skill technique, and I would like to take a representative sample from all department proportionally equal, and I will send a questionnaire. I will conduct an interview just to look for what they need in terms of the training. And this, of course, need a tool. So I have to design my questionnaire. I have also to design my checklist. I have also to design my interview questions and with some guideline to specifically tailor to a certain department. Not only that, I will go and I take random sample from the human resource department about the performance appraisal from the last year. And this is definitely will give me how the employee are well. Then after that, I will combine this data and I came with the CEO by areas of the training needs. But before you go into the CEO, you have to conduct what is called, the quality people say, Gimba walk. And the Gimba walk, you go on the ground, talk to people, observe the performance to see what exactly in their mind and what is the behavior. And maybe when you observe somebody who is working in the communication of the customer, and you observe that his communication skills is not appropriate, and can cause customer dissatisfaction. So from this conversation, you can elicit that the communication skills should be one of these people who are working with the customer. And after that, you develop your training need checklist or a training need list for the next year. Definitely, you have to use a quality tool again to prioritize the training need in the area. So in summary, training needs is, we already mentioned it here, why we do it. We need also to develop, to mobilize the resources. We would like to develop the curriculum. If I would like to develop a training module or curriculum, definitely I need to know the training needs. And also, we would like to align with the adult learning theory. And what adult learning theory mentioned in this regard, it mentions that adults learn well when the training fit their real need. Therefore, why we conduct the training need assessment. And we already talk about it is the gap between the desire and ultimate and current. We need to involve the trainee. We will involve the learner in the process of the learning assessment. And the most important thing, we said, I would like to assess the knowledge. So what type of the knowledge you would like to assess? And therefore, be careful. You have to be with clear objective and clear assessment methodology in order to assess the clearing. Therefore, I ask, are you going to assess the knowledge? Because assessment of the knowledge, it needs certain tools or even skills or even behavior and attitude. Any questions so far? أي سؤال يا شباب؟
Hello, sorry.
Any question?
Hello.
Yes, yes, please, Sharif. Yes.
Sorry, I want to ask you one question. What is the difference between teacher and expectation and student expectation?
What is the difference between what? Can you write it in the chat, please?
What is the difference between student expectation and teacher expectation?
Excellent, excellent question. Thank you so much. The student expectation and teacher expectation. This is definitely varies according to the context of that. For example, you are in the first or second year medical student. What is your expectation? You expect that the teacher give you a curriculum, not very hard, not condensed, problem-based learning, competency-based learning. And you, as a student, you expect that to study medicine, not maybe like what we studied previously. We have 2 years anatomy and physiology and biochemistry. No, your expectation to be a problem-based approach. So this is your expectation, your wish, your will. However, what is the teacher expectation? So the teacher is a university, definitely his or her expectation different. So he expects, for example, the student digest his material. He expects that you will pass the exam based on the content he delivered or the content you imparted during the curriculum development. So the teacher expectation and student expectation definitely varies based on the context you are talking about. Is it clear, Sharif? واضح يا شريف؟ Clear?
Thank you. واضح واضح. Clear. Clear.
Okay. Any questions so far يا شباب؟
It's clear, thank you.
Thank you. طيب any question من الباقيين؟ في ناس ظهروا. صلاح، في واحد اسمه صلاح. والله who is the name here? I cannot read it actually. Yes, can you introduce yourself please? Any question? Okay, let us move on. So this is how we do it. We talk about observation, questionnaire, interview, but there are two things here very important: task analysis and job analysis. Okay, what is that? When we say task, if you come to your office, for example, in organization which use an agile approach of management of their performance, and the quality people, they know this very well. You will find the board, it's called Kanban board. In this board, there is some task. And this is actually one way of a pull communication. And the employee coming, so you see, Hunaida today or Hunaida today do this and this. Sharif do this and this. This is the task already assigned to you, Hunaida, and assigned to you, Sharif, and assigned to you, Sarah. So what is the task? Task simply is the activity you would like to perform. But in order to do a task, you need to be competent. I cannot ask from Hunaida to type a PowerPoint presentation or to prepare a PowerPoint presentation unless she have the competency of how to write a PowerPoint presentation. And therefore, what is competency? Competency is simply observable behavior, whether it's a knowledge, skill, and attitude. In our contents, it is skills. How to type and write a PowerPoint presentation. This is kinetic, this is skills. It is not only kinetic skills, it is also the mental capability of writing a PowerPoint presentation. So one way, try to assessing the needs, I should analyze the task. So the task, what does this task consist of? What is the ultimate deliverable is to prepare a professional PowerPoint presentation. So in order to do that, definitely, when I divide the task, she need to have some idea about the software and using software. Okay, when she starts, she said, okay, I can work in the computer. And I started to do like this, very slowly. So this is also, she is slowly, maybe she need to be trained to be more quick in the writing. And if she develops a slide, but is not professional, she needs the training on how to prepare a PowerPoint presentation, and so on. So any task, you can just divide it into several deliverables, several mini tasks, and analyze it. And some PMB people, they talk about this called work breakdown structure. And the work breakdown, you just divide the work into simple tasks. And here is the same. You just define the different tasks in one task, these subtasks to make some analysis. And you remember the analysis between the desired and the current analysis. So this is the task analysis. Again, what is job analysis? Job analysis is the job you assign to do something. So my job, I need a secretary. So the secretary, I would like to analyze the standard of the job. So the secretary should be fluent in English and Arabic. So this is one competency. The secretary should be fluent in computer. should be fluent in communication skills. So I will analyze this job analysis, and I try to see if I hire some secretary or another secretary, she or he should be fluent in English. See, if not in English, so maybe in the training program to have an English language skills or training program, or even fluent in communication skills. And again, she will have communication skills. So by this, I conclude just to make summary, because this is the last slide, talks about learning and teaching. This is, we'll talk about it tomorrow, don't bother about it now. So what we did today, we started about the objective of this training program. And we talk about it, one of the challenge, most of the trainings that I conducted as a TOT, it is face or physical training, where the participant interact يعني physically and deliver some training and like that. But now within this COVID-19, this is definitely, we will try to adapt and we make the change in the curriculum to make it more interactive. I'm also very happy because the number of the student is for example 10 or 8. This is excellent, because we will do some interaction and we'll do some interactivity, which is good. But I'm also not happy because some of the participants did not participate. So please, tomorrow, inshallah, tomorrow what I guess, because I have another commitment maybe at 7:30 up maybe to 9 or 10. So I just maybe I'll arrange with Dr. Atfa to see whether we can make it early, if possible for you, can make it 5 o'clock or 4 o'clock, or if not, the day after tomorrow, we can start early. Instead of starting 8, we start at 7. We will see to do this inshallah later. And inshallah, after the 5 days, maybe the last day, I will ask you to do something in your organization. And I need from you all tomorrow morning, try to just to do something of this. You do task analysis, job analysis, 10A, what is training, what is thing, because this is the way we learn. If we learn something and we try to implement it, definitely we will never forget it. And if we go further and teach it, definitely we will improve our performance. Any questions so far? أي سؤال يا شباب؟ الأمور طيبة واضحة؟
واضح. شكرا يا دكتور.
شكرا هنيدة. هنيدة.
واضح يا دكتور. Thank you.
Thank you. الباقي الباقي ممتنعين عن الكلام ولا شنو؟
Then what does mean greed and expectations?
Thank you Sharif. Thank you.
Hello.
عندك سؤال ولا شنو يا شريف انت؟ والله just comment.
لا. And great expectation, what does mean? And great expectation, I'm asking question. Great expectation, what does mean?
The expectation is mean what you would like to expect of something. For example, what is my expectation? I expectation from you to be an effective trainer. This is my expectation. توقعات. So expectation means what you need. What you expect from somebody. Did you understand?
I understand. Thank you.
اوكي. طيب شكرا لكم. بكره ان شاء الله بنشوف نعملها 200 بدري متاخر المهم، وان شاء الله نلتقيكم بعد.
The workshop is the workshop will continue or end it?
No. We will continue for 5 days, inshallah. Tomorrow up to Thursday. So,
The next
tomorrow,
workshop. The next workshop. Tell me.
Yeah, tomorrow we will make some modification and we will be notified in advance about this notification. Don't worry.
And what time?
Yeah, we will agree upon it. Just we will see the different other opinion. Don't worry, inshallah.
All right, inshallah. Thank you.
Thank you. شكرا لكم وان شاء الله يعني نلتقيكم بكره ان شاء الله باذن الله.